All right, so pleasant good evening, everyone. Welcome to our training session, Digital Learning Tools to Train Nurses. I trust that everyone is having a very productive evening so far. This evening session will be presented by myself and my co-facilitator, Lishan Allen Campbell. And in today's session, we will cover two digital learning tools, Full Code Medical Simulator and Mentimeter. Now, before we begin, let us cover our ground rules. Expectations for a safe, engaging learning space. We want everyone to reflect honestly, ask early, ask often, think patient safety first, participate actively, respect every response, and use devices for learning. Now, our agenda, we will start with the icebreaker, cover the digital tools, demonstrate how they are used in day-to-day activities, walk you through a group activity or case study, and give you a formative assessment in which we will do the recap right after. Now, for our learning outcomes. By the end of the session, you'll be able to explain how Full Code Medical Simulator and Mentimeter support nursing education, navigate and complete one assigned patient care scenario in Full Code Medical Simulator with a minimum accuracy of 80%. Actively participate in a Mentimeter-based adaptive learning activity by responding to polls, quizzes, or reflection prompts. Alright, so now for icebreaker, caption this image. You can click in the chat on the Mentimeter link and you can give your response of 1 to 2 words and you will review the answer short. You can now go ahead.
But he does one go left checker, reach back a 301 and reach back up by a 302. I no.
In the meantime, you can type in the chat as well if you're unable to click on the link.
Not serious.
Yes.
We only see the evaluation.
You're not seeing the link?
No, only evaluation. I found the link. It's a first. It's a second link. It says evaluation form, then icebreaker. The second link.
Alright, there we go. You can just click on it shortly and let us get some very funny captions to start our day off.
So she just have to have Jonah and go up in the NY same time? Oh. Go and get ready for prayer meeting. Bye.
Alright, so I see some responses coming in. We see engaging, fun. The patient is scared. What's joke to you is this to me. Nursing class. How to lose your job in 30 seconds. Nurses in training laughing at the patient on the screen. Heart problem. Seems like the nurse is making fun of the patient's condition. Thank you so much for participating in our icebreaker, guys. Give yourselves a round of applause. In the chat. Alright, so our first digital tool is called the Full Code Medical Simulator. Now, this digital tool falls under the category of simulation in nursing education, where it enables healthcare professionals looking to enter the field to engage in complex, risk-free, gamified environment. Now, there are some benefits to using this application, and it can be downloaded by using the Apple Store or the Google Play Store on any device of your choice. Now, with a thorough debriefing, in which you get a summary of the case that you're going to actively solve or figure out. It has mobile accessibility. It has risk-free intentional practice, and it has an extensive clinical library of 291 international renowned medical cases. Now, 2 drawbacks using this application. It has limited dialogue and distractions, and it has insufficient training in physical and technical skills. Now, I'm going to go through the software and I'm going to walk you through a basic scenario where we'll all stop and pay attention on how to figure out solving this case. Let us go to the website. All right. So once you log on to the website, this is the user interface that you'll be seeing. We'll be using the free version for today. All right. So once I click on this case, you show a raise of hands to see if you can state the first step in terms of helping this patient reach their ideal goal, or in terms of solving their medical situation at the current moment. Let us click on the case library. Now in this training session, we will cover a 22-year-old female who had a rash and throat tightness after eating a meal at a restaurant. So in this software, it gives you a thorough debriefing of the patient along with their age and name and the possibility of what caused their current medical situation. Now let us continue. Now as you can see, you have the title here in the prompt box, name of the patient, the age of the patient, and the medical category that she or he is experiencing at the moment. So as you can see, she has an allergic reaction. She has a respiratory problem, and now she has a rash. Now let us play the game. So as you can see, the dispatch or the emergency medical team, they would normally dispatch on the radio with the ambulance that the patient, as you can see, is having difficulty breathing and facial swelling after eating shrimp. Now, the epinephrine auto-injector has not been administered as yet, and you have at least 14 minutes and 32 seconds to administer something to her. Now, with a raise of hands, can anyone tell me, just a hypothetical guess, what would you do if someone had an allergic reaction to eating shrimp, and they had a rash, and they had respiratory problems? Can anyone go ahead and raise their hands or mute your mic? All right, go ahead, Marsha.
I think I would give them a mouth-to-mouth respiration, something like that.
Mouth-to-mouth resuscitation?
You hear me?
Yeah, I'm hearing you clearly. I would recommend that for CPR. For CPR. Kimberly, go ahead. Let me hear your response.
I take them to the doctor because you don't know what they have, so you have to consult professional medical advice.
All right, but you are the professional. We're currently at the back of the ambulance. What tools would I need to use to help Emilia? A what?
An EpiPen.
An EpiPen? Are you sure?
Yeah.
Procedures, let's click on procedure. This is the wrong slide. I'm clicking. Let's go over here. Stabilize. All right, so based on everything that is under the stabilization actions, what would you administer to her to, stabilize her breathing and kind of control the rash until we reach the hospital? Any guesses? I saw Johnson. Go ahead.
No, Lord, man, I'm sorry. I was going to ask the first question.
Oh, Marsha, go ahead, or Shadeen.
I'll try to give them some antihistamine because it's an allergic reaction. So
antihistamine. All right. So what would you? All right. Seeing that the respirator is the most it's the issue at hand. Because we
Right,
can
so
solve the rush
airway.
later. Repeat that for me, please.
Deal with the airway issue first.
Alright, so we should pre-oxygenate for intubation then.
Yes.
Alright, that is the first step regarding dealing with a patient of this nature. Alright, so if you understand what we're doing in this simulator software, can you just show a thumbs up in the chat for me, please? Let me include this. Let me see if the time is in chat. Alright. Let me see something. Alright. So based on the full code medical simulator as you've seen before or now, this is it's a 3D interactive platform which has over 291 medical cases, which you can actually sit down and play through and understand how the PPEs are used by the EMTs on site and how different allergics, how different foods affect your body, and you know how you respond to different situations regarding the age and the BMI of a patient and the speed and delivery of the EMTs to be on site. So as I said before, this is a very intuitive platform for you guys as nursing trainees looking to train nurses at the Paboga VTDI, nurses that are looking to enter the healthcare industry within 12 to 18 months, right? So we must be on top of our game in terms of knowing the medical terms, the tools, and the PPEs to ensure that nurses that are going out there are fully equipped to assist the patients. Now I will move on to our co-facilitator, Lishan Allen Campbell, which will walk us through using Mentimeter, which is an adaptive learning system for nurses.
Thank you so much, St. Stephen. Good evening, everyone. All right, so for the Mentimeter, this is a cloud-based polling and presentation tool that enhances session by creating interactive experiences. Participants can use mobile devices to vote in real time or respond to questions. So Mentimeter basically is a software that allows you to make any type of presentation. So you can use Mentimeter presentation from anywhere. All you need to do is to join through a code. We are going to look at some pros and cons using Mentimeter. All right, so the pros now, it enhances engagement and attention. It also promotes candid feedback. It is very user friendly, and it provides immediate data and insights. We can look at the cons. So we have two cons for the Mentimeter. It requires a stable internet connection, so your internet has to be stable. It is not a learning management system. All right, so with that said, we are going to demonstrate how to use a Mentimeter. All right. So what you're looking at is a home page for the Mentimeter. On your left, you have the home, you have My Mentis, and you have Share With Me. So My Mentis is normally used when you have previous presentation. You can always go back to it for reference. Share With Me is what you use to share your Mentimeter or your presentation. All right, so now we are going to create a new presentation. So you're going to go to New Mentis. Next, then you're going to go to My New Slides. After you select My Slides, you are going to see some drop down here. Here you have multiple choice, so you have options on how you want to create your presentation. And we know what multiple choice questions are. We have open-ended questions. We have word cloud, and this is where participants, once you submit a few words in response to the questions, you have skills, you have question and answer. So we are going to focus on the open-ended question. So since we are dealing with nurses, we're going to type, should a person eat something that they know that they are allergic to? So there you have it. Once we type in that, we can use right, so we can select. You have 3 options where you could write your responses. All right, now we are going to look on our case studies. So we have 3 case studies that we are going to look on, and we are going to go into breakout rooms for these case studies.
To do the chairs and this. We have enough this.
All right, so we have scenario 1. So a trained nurse used full code medical stimulator for a 58-year-old male from St. Catherine at a parish hospital with chest discomfort, shortness of breath, and dizziness. The nurse must assess patient data, review vital signs, identify priority concerns, and select nursing intervention. So that's case 1. Case 2. So we have on screen, so we're going to have 3 groups. So we're going to have 3 groups. One is going to assign with case 1, then we have case study 2, and then we have case study 3. All right, so case study 2 stated that nursing students use full code medical stimulator for a 35-year-old female patient at a rural health center in Portland. She presents with fever and weakness, then begins to deteriorate, blood pressure drops, heart rate increases, and communication becomes difficult. So that's case 2. And case 3 is a nurse educator in Jamaica a nurse educator in a Jamaica nursing school demonstrates a full code medical stimulator case involving dehydration after several days of vomiting and poor fluid intake. Students observe the case and discuss possible nursing priorities. So can we have the breakout room with 3 groups? So each group will assign to case 1, case 2, case 3. So group 1 will take case study 1, group 2 case study 2, and group 3 case study 3.
Breakout rooms are open. Please move to your breakout rooms.
Discuss again. And when we hear the children just gonna palaver sitting, just happening. Miss Allen go with this. Miss Allen go? Okay. Miss Allen? When am I going to get delivered? When? Lord, when? I don't know which part is up there. What's the tiny?
Who can wash and blow me here? How much you wash and blow me here?
You can't wash it.
But no,
Why can't wash it for no one here, girl? Why you can't wash it
if you
here?
blow me here.
Eh?
What's money for blow you out from?
Oh, you have to want something there?
Roger? Manuel, you give me money to buy it one time, you know. Yellow bird?
Oh, a yellow bird.
A yellow bird, the man will give me money to buy.
Yeah.
Feel like mother go wash and blow me hair today. This is
Hmm?
how I hairdresser.
Hmm?
Feel like mother wash and just go wash it and blow your hairdresser.
I guess we'll wash that. One time, knock off on the stairs again, she. You used to pull my hair here. Yeah, I used to pull my hair. Yeah.
You feel me, no?
Yeah, go on, you soon done, man. You soon done. You should have find the assignment application.
Yes, mommy can, what is subject to this one?
Hmm?
Now when them start all night, I'm here, just missing this, now this. It's part of my business, when I get TP.
Of course, we see them sitting there. You have payment there?
No, sir. As a matter of fact, they're attached to me. As in the matters we give people, like, unless you really we give both of them. That's a 9 hour. Sanoy. Yes, Sanoy. You see the Rap City quotation? What is it? Just say exactly what it is for.
Look what you do with your hand.
See, that's what I like to. My name again. Alright, exactly, because we're right. What it is for. So, what was it? No, we don't put all of that information. Summarize it.
Banners.
To purchase banners for.
Then be agriculture.
Alright, subject. Banners.
Later, the trainee nurse should recognize the patient worsened
Go back in
vital.
the menu.
Hanging banner, one hanging banner, one feather banner.
Okay. Alright, so banners for. Then the agricultural show.
Alright, so we are back in the main group. So St. Stephen will hold a discussion for each cases.
Yes.
Thank you so much, Lucian. Now for case study 1. A trainee nurse uses full code medical simulator for a 58-year-old male from St. Catherine at the parish hospital with chest discomfort, shortness of breath, and dizziness. Nurse must assess patient data, review vital signs, identify priority concerns, and select nursing interventions. Now, based on the case study which was shared, what do you think is the first priority in this scenario? And how should the trainee nurse use the full code medical simulator and Mentimeter to demonstrate clinical judgment and participate in adaptive learning?
I created a song on it.
If you're ready to answer, if you can go ahead and raise your hand or mute your mic.
Yes. Sorry. Marcia here. So for our group, which was group 1, and we looked at this and we realized that the trainee nurse should have used like a full code medical simulator. And what this would do is to assess the patient's condition. And this is done by reviewing the vital signs. And they look at the symptoms and how the patient's history. The nurse could also identify the chest pain with breathing difficulty as a priority concern and select like safe, appropriate interventions according to nursing protocols, such as alerting the healthcare team, also by monitoring vital signs and also preparing for further assessment. When we look at how using the Mentimeter now as a trainee, we'll respond to the trainees' questions and we'll compare their answer with the class's response, and actually this helps the trainee reflect on whether they correctly identify the priority nursing action and also learn from the feedback that was provided by the peers and also the facilitators.
Okay, Marcia.
Mic is mute, St. Stephen.
All right, I'll see you next semester, right?
Oh, I do apologize. Thank you so much for that response, Marsha. And now we'll move on to case study 2, where a nursing student uses full code medical simulator for a 35-year-old female patient at the Rural Health Center in Portland. She presents with fever and weakness, then begins to deteriorate, where her blood pressure drops, heart rate increases, and communication becomes difficult. Now, based on this scenario, which patient finding shows the most urgent need for escalation of care, based on your analysis of the case?
You want to try it on it?
It's one like that?
Yes, one like that.
Anyone from room 2?
Try it on it for me.
Okay, so in a full code medical stimulator, the trainee nurse should recognize the patient worsening vital signs and reduce their responsiveness, which may indicate clinical deterioration. And also the trainee should prioritize patient safety by reassessing the patient and reporting the change in their condition promptly and selecting the appropriate next steps based on the stimulation options and nursing guidelines.
Okay, all right. Thank you so much, Rusan, for that response. So I guess we have future doctors and nurses in this training session. Now let us move on to case study 3, where a nurse educator in a Jamaican nursing school demonstrates a full code medical simulator involving dehydration after several days of vomiting and poor fluid intake. How can full code simulator and Mentimeter work together to improve nursing education in this scenario? Anyone from room 3?
Alright, so the full code medical simulator will allow students to experience a realistic patient care situation in a safe learning environment. It will also allow them to observe or practice assessing symptoms, interpreting patient data, and identifying the priorities, and also selecting suitable interventions without placing a real patient at risk. And how does the Mentimeter work with the full code medical simulator? So it will encourage the students' participation and reflection after the simulation by submitting, where they can submit one-word responses about their confidence level, and students can express how they feel about the learning experience.
All right, Javina, thank you so much for your response regarding case study 3. Now, for a recap for this training session, trainees, our key takeaways: full code creates a safe space to practice clinical reasoning with realistic patient care decisions. Mentimeter keeps every trainee involved through polls, quizzes, and reflection prompts, and feedback connects performance, confidence, and next steps for nursing practice. When digital tools are used purposefully, they support safer practice, stronger engagement, and better feedback. Before you go, we have our references and we have our evaluation form in the chat. Please go ahead and fill it out. Again, thank you, trainees, for such a wonderful evening. We appreciate it.
No cross trainer.
No, not yet. Last one.
Thank you, St. Stephen, and
What's this?
I see with the other one that you have at home.
Oh, so you want one blade like this?